Welcome everyone. This is Dr. Jaitly, your cardiologist from New York, on your favorite website, MuniMeterHealth.com, which is dedicated to educating you and teaching you about the human heart and cardiology. We are picking up one subject after the other in our video vignettes, and I'm so thankful and appreciative of your enthusiastic support that you have given us from across the globe, from one end to the other. So thank you again for joining us on MuniMeterHealth.com. Without any further ado, I'd like to delve into the subject matter. The matter of the subject today is, what is Cushing's disease, and what are the cardiovascular effects, if you will, or the clinical features as a result of Cushing's disease. So we know Cushing's disease is an excess of ACTH production. Now, ACTH production can be either from the pituitary, and when it's arising from the pituitary, obviously it's called Cushing's disease. So that's the original name. But then ACTH, which is arising from the ectopic sites, including the adrenals, and say you may have adrenal adenomas. And when you have adrenal adenomas, this one is actually, so the ectopic adrenal adenomas and the ectopic ACTH secretion, say from the various cancers, those are called Cushing's syndromes. So we need to identify where the ectopic ACTH production is from. Now, normally there are, there's a list that's provided in the cancer profile patients. We have these patients who have either a thyroid involvement from the medullary cancer carcinoma, or they could have, say, a small cell carcinoma from the lung. Islets of pancreas, islets of Langerhans, and pancreatic cancer is very important, and that also is responsible for producing ACTH. And then there are some hematological malignancies, if you will. So hematological malignancies will also lead to Cushing syndrome. Now let's draw our favorite diagram here. This time I'm going to do a schematic of kidneys, because that's where your adrenals are sitting on the top of the kidneys. There's your right kidney, slightly lower, and then you have the left kidney. This is the favorite way I draw it. A little indentation here. Then you have, these are your pelvic calyces draining into the ureter, okay, and then into the bladder and out. You have your aorta coming down like this and supplying the renal artery, and then this is your left renal, and then the aorta further continues until it divides into the right femoral and the left femoral. We also have the veins, which are from the pelvic areas of the kidneys. These are tributaries. These are right renal veins. This is your left renal vein, and they're draining into the inferior vena cava, which is running right next to the aorta, if you will. So here's the inferior vena cava. So you have IVC, you have aorta, and this is your right kidney, and this is your left kidney. The adrenals are, by the way, sitting on the top right here. So this is your right, and this is your left. So these are your adrenals. So adrenals, normally they are, let's magnify this here, and adrenals normally have three layers. What are the three? Normally have two layers. One is the cortex, and the other is the medulla. However, the cortex is divided into three. That's what I meant to say. So zona glomerulosa and zona fasciculata. These are long terms, but I'm just writing a smaller way. And zona reticularis. So these two zones, fasciculata and reticularis, they are the ones which are responsible for secreting the androgens and the cortisol. So they secrete androgens and cortisol, and they both are being governed. Both these zones, fasciculata and reticular, they're being governed by the ACTH, whether it's coming from the pituitary, as we talked about, or whether it's coming from the ectopic variety. So either of those two will lead to an ACTH production through the pituitary, or whether it's from the ectopic areas, including the adrenal adenomas, and they will have this as a manifestation, because they will be they'll be attacking those cells which are responsible for secreting androgens and the cortisol. whereas zona glomerulosa is primarily involved only in production of aldosterone. So remember that. So zona glomerulosa, and that is being controlled by angiotensin 2 rather. So AG2 will control that. So we have AG2 and we have ACTH. AG2 is acting on the production of aldosterone through zona glomerulosa, whereas ACTH is acting on the fasciculata and reticulosa to produce androgens and cortisol. Okay, so that is the nutshell or the hemodynamic or the pathophysiology of what's going on with the Cushing's disease. So having understood that, what are the cardiovascular clinical features? Now, cardiovascular clinical features obviously are primarily hypertension and accelerated atherosclerosis. Now, one of the features of accelerated atherosclerosis is obviously involving all vascularities. So starting from, say, cerebrovascular disease leading to stroke or TIAs in a very premature, earlier age. They have severe hypertension also because of the peripheral vascular disease that ensues. Then you have CAD, coronary artery disease, and that leads to early MIs and heart failure. Ischemic heart disease will develop, and then of course angina, etc. So these are the other manifestations of accelerated atherosclerosis. So in a nutshell, the treatment will be obviously surgical and quick replacement with mineralocorticoids and glucocorticoids immediately after the surgical resection is done. So resection is either at the pituitary level, and if it's done at the pituitary level, then obviously it's a transphenoidal the resection that's performed. Hypophysectomy, as we call it, transphenoidal hypophysectomy. And if it's an ectopic variety, if it is, then we have to worry about taking the adrenal adenoma out. So that's again is a resection. So, or else treating the cancer per se, whatever the cancer that's producing the ectopic ACTH that requires its treatment. Nevertheless, you'd still have to treat them for stroke, the peripheral vascular disease, the coronary artery disease, the MI management, the heart failure management will be exactly the same as you have been told in other videos of mine with several other subjects we just talked about. But the predominant manifestations are hypertension at a very early age, and these are again very, very severe hypertensive patients, and they also have accelerated atherosclerosis if you were to look at that. Okay, so in a nutshell, you've learned about Cushing's disease, and Cushing's disease is also, as I said, Cushing's syndrome, which is related to the ectopic manifestation of ACTH production from the cancers or from the adenoma, whereas Cushing's disease is primarily from the pituitary ACTH excess. So having learned that, then we also know that the various layers of the adrenal cortex and adrenal medulla. Adrenal medulla is of course responsible primarily only for epinephrines and norepinephrines, and that we will talk about at a different stage because they have different tumors and they have very interesting cardiovascular manifestations. The cortex is divided into three layers: zona glomerulosa, zona fasciculata, and zona reticulosa, and all of these are very, very important, but fasciculata and reticulosa is the one that's concerning us because that produces androgens and cortisol, and it is the cortisol production that actually leads to development of accelerated atherosclerosis primarily. And cortisol, we know that's it's also anti-inflammatory, but actually here in the atherosclerotic process, it is considered as inflammatory more so, and therefore leading to increased tendency for accelerated atherosclerosis. So once again, I thank you for your attention at MuniMeterHealth.com, your favorite website, which is available on social media channels for you, and you're staying tuned in. So hopefully if there's a question or a query asked on, which is likely at least one or two questions will be on the boards or on your exams about, specifically the ones who are taking the cardiology boards, the Cushing's disease and its cardiovascular effects. So now you have some basic good knowledge about the ectopic ACTH variety as well as the one that's secreted from the pituitary. So look forward to seeing you again on my next video. Thank you again so much. This is Dr. Jaitly. So long. Bye.